Hello, my friends, and welcome back to another episode of The Dirty Truth. America has a problem, and it's an elderly problem. And I'll get right into this video to let you know what I'm talking about from this Fox 5 Atlanta news story, but it has nationwide reaches.
Hundreds of Georgia nursing homes may soon have to hire more nurses and aides. Last week, the Biden administration finalized new minimum staffing requirements for long-term care facilities. The response here in Georgia has been sharply divided. The Fox Medical Team's Beth Galvin shares why this has become such a hot-button issue.
During the public comment period, about 46,000 people weighed in on this issue, and advocates say that this will help make sure people who are living in long-term care facilities receive better quality, safer care. But the nursing home industry says there is no funding to pull this off, and nurses are incredibly hard to find right now. About 15,000 U.S. nursing homes, home to more than 1 million mostly older Americans, will soon have to meet new minimum staffing requirements. The Centers for Medicare and Medicaid Services, or CMS, says that means the average nursing home of about 100 residents will have to have at least 2 registered nurses and 10 to 11 nurse aides on staff each day. And homes must have 1 RN on duty 24/7 to provide skilled nursing care.
We deal with an extremely vulnerable population, particularly a population where many of them are living with dementia. So I understand that expectation, and I completely understand the government, because of that, wanting to put some sort of standards in place.
But Deke Cato, CEO of AG Roads, which operates nursing care facilities in the metro Atlanta area, says nursing homes are already struggling with a critical staffing shortage worsened by the pandemic.
It is especially difficult in nursing. Registered nurses in particular are extremely scarce in supply.
It's a problem echoed by Chris Downing.
In the state of Georgia right now that doesn't want to hire more staff. They all want to hire more staff. The problem is they aren't there.
The staffing rules will be phased in over 5 years, giving rural nursing care facilities more time.
I'm gonna pause it right there. Nursing homes can't find staff. They lost a very large percentage of their working staff during the pandemic, and they have been unable to replace them.
Time to staff up, and there will be no federal funding to pay for more staff.
To say that I'm disappointed is an understatement. This was really a huge swing and a miss by the administration.
But Melanie McNeil, Georgia's long-term care ombudsman, supports the minimum staffing mandate.
People are demanding better care.
I get that people want better care, they want better scenarios, but you can't force people to do certain jobs. They may do that in other countries, but not in the United States. People pretty much can do whatever job or work whatever job they qualify for. And in many cases, they're going to go with the highest paying option.
And raising these issues.
McNeil says 2 of the top 5 most common complaints they get from residents are about slow staff response times when they push a button for help or need assistance with basic hygiene, like using the bathroom. So McNeil says staffing minimums are essential.
I think the industry probably told you that the residents are more complicated than they used to be. They have more residents with memory care issues. They have more residents that have multiple chronic conditions.
And the new staffing mandates will affect long-term care facilities that receive either Medicare or Medicaid funding. And as part of this, CMS has launched a $75 million nursing home staffing campaign. They say this will provide financial incentives to nurses to work in nursing homes. But the nursing home industry says these changes, these staffing mandates, will cost them up to $6 billion. For your Fox Medical Team.
Okay.
I'm Beth Galvin.
You heard that they got a problem. Nursing homes have a problem, and it's not going away. It's only going to get worse. And I found another article from Skilled Nursing News. More than 2/3 of nursing homes fear closures, as almost all Cite challenges recruiting staff. And they have some statistics on here. Currently, 94% of nursing homes say it's difficult to recruit new staff, with 67% citing a lack of interested or qualified candidates as a huge obstacle. and pretty much all nursing homes are hiring. I got some more stats on here. I don't want to bore you with all of that. Long story short is they need people and they're not getting them. And they've even, well, you say, well, if you pay people more, they'll do the job. Well, they are paying higher wages and people still are not going into that job. My mom has done it for probably 20 years now. It's a very difficult job. Everybody is not fit to do it. So I can certainly see how difficult it is to hire people in that industry. But it's going to cause a huge problem as we have an aging workforce. More and more people are going to require nursing home assistance. Families are just not set up to take care of the elderly, elderly grandparents, elderly great-grandparents. We're more spread out. We have probably more single individual homes, meaning and unmarried individuals, which people are basically taking care of themselves as an adult, and having to bring in an elderly person into that situation would be extremely difficult for them to have to go to work every day and provide for an elderly family member at home with just themselves and their single resources. What does that mean long term? Well, if you haven't heard, the U.S. debt is on pace to top $56 trillion over the next 10 years. And the reason I'm bringing that up is because people are going to say, well, if the private industry can't fix this problem, they're going to turn to the federal government, which is usually what happens when private industries can't solve a problem. The federal government steps in. But $56 trillion, and I don't know if that number is anticipating more federal funding towards nursing homes or not, but it's going to create a huge financial issue. Nobody likes to raise taxes. Nobody likes their taxes raised, paying more taxes, but I don't see how we get around it. And I've done another video on the fact that more and more people are opting not to have children, which we're not seeing those effects now, but in about 20 years, we're going to see a labor shortage from lack of people deciding not to have families, not to have kids. And that's going to create an even further strain on this crisis at nursing homes, as we'll have a population in the United States that is outside or above working age. And when you have the majority of a population of a country where the majority of their residents are outside of working age or have gone beyond past working age, that creates a huge strain on resources, tax collection, just about anything you can name. So I'm going to end it right here. I hope you guys found some value in this. I think it's very interesting. I do a lot of stories on things that are maybe not an issue today, but in 15, 20 plus years, it's going to be a huge damn issue. So like, subscribe, share this video. I really appreciate it. Until next time, peace.